So a patient we have today, patient presents with abdominal pain, right side abdominal pain, and diarrhea, 10 to 15 episodes. Now that should have been recognized and should have been in isolation already, but she wasn't. So I walked in, she's got a heart rate of 107, she has persistent abdominal pain, and her history is she was in the hospital a month ago with colitis. It was non-specific colitis. I thought it was infectious. She tested C. diff negative back then, but she was treated with Cipron flagyl and sent home. So that person, by definition, is high risk for C. diff, hospitalization, recent antibiotic use, and presents with SIRS. She has a heart rate of 107. She ended up with a white count of 20.2, and she has a possible source infection, the diarrhea. So that makes her septic. So she should have had sepsis bundle and trigger, and it wasn't. So as soon as I saw the patient, I triggered that, put her in isolation, that kind of thing. Now, because the risk is C. diff and because the risk is pretty high, then the antibiotic of choice should be vancomycin right away. I actually just had this conversation with Dr. Tiara, the GI specialist, that people with high risk of C. diff should just skip flagyl and go straight to vancomycin. I did not know that. Apparently there's been a fair amount of resistance. Now you guys know that C. diff or Clostridium difficile causes pseudomembranous colitis. That's just one of the many different types of colitis. Colitis is by definition colonitis, colon inflammation, and a subkind of colitis is proctitis, in which just the rectum that's inflamed. Of course, proctitis could be chemical. People who do things and put things like spermicides or gels or something. Could be traumatic. People do rectal intercourse can get proctitis. Of course, sexually transmitted, gonococcal proctitis and chlamydia proctitis and other things like that. And then the colitis in general are subdivided into infectious, and that could be bacterial, which we know, Shigella, E. coli, Campylobacter, and so on. And of course, C. diff. Viral, a viral enteritis can give you a colitis, and could be even a fungal. That's the infectious. Then you got the non-infectious colitis, which are the inflammatory colitis, and that's the Crohn's disease and the ulcerative colitis. The main difference between ulcerative colitis and Crohn's, ulcerative colitis tends to affect the whole, ulcerative colitis affects more like a shallow ulceration or irritation of the bowel, but usually distal bowel. Crohn's disease tends to be the whole bowel, but in skipped segments, and it's transmural. It means affect the whole bowel wall. And it's almost like they think an immunologic attack. They think that a lot of illness, even chronic conditions, are because of an antigen exposure to something. So a lot of these illnesses are because they have some kind of infection, it triggers some antigen, and the body starts attacking that, and instead attacks your own body. So inflammatory bowel disease is thought to be immune-mediated disorders. And then ischemic colitis, which are older people with vascular disease, lots of calcification in their belly and stuff, and they have low circulation. Usually ischemic colitis, they have, of course, pain out of proportion to exam, and bleeding. They're bleeding their bowels. Necrotizing enterocolitis, that's more little kids, babies, where hypoxia during birth and things like that, prematurity and whatnot. And all right, so we talk about the subclasses of colitis. So this patient, what's our approach? She had a high white count, she has SIRS, sepsis criteria, she has abdominal pain that even after medicine's recurring, she should be admitted, because of the risk of C. diff. So I put her in isolation, started vanco, started fluids, and then she should have the colonoscopy, which she actually was scheduled for next week after her admission to the hospital last month. So, quick update on colitis for you.
So, in addition to that, is make sure that we're still putting precautions on patients with diarrhea, because from what it sounds like, the patient was put in the room and the precautions weren't put up. We haven't stopped that, and you haven't got communication